Hi guys, good morning. We can see the new topic, that is the deep vein thrombosis. And deep vein thrombosis, as you know, that is the thrombus formation, especially in the leg. And it is a serious condition once it become a and means the blood clot become lodged in the lungs or the circulatory system. And we can see the etiological factors. There is a venous stasis, then hypercoagulability and injury to the vein walls. These are the three main etiological factors behind the deep vein thrombosis. And the venous stasis means that is the immobilization or absence of the calf muscle pump causes and venous stasis, and it is especially seen in cases of surgery, immobility, obesity, pregnancy, paralysis, and the CHF, that is the congestive heart failure. In the hypercoagulability, that is, it is often accompanied by malignant neoplasm, that is the hematological disorders, and use of contraceptives may lead to the hypercoagulability. In dehydration and blood dyskaryosis, they rise the platelet count and decreases the fibrinolysis, increase the clotting factors, or increase the viscosity of the blood, and that will be leading to the hypercoagulable state of the blood, blood, and that will be leading to the blood clot formation. In the vein wall trauma, as you know, once there is a trauma in the vein walls, that may be leading to a thrombus or the vein wall rupture, that may lead to a platelet formation, and there will be a formation of the means blood clot will be forming, and that may be getting lodged in the deep veins, or it may transfer into the other parts of the body also. Then the main risk factors are surgery, then congestive heart failure, myocardial infarction, cardiomyopathy, and the malignancy are the main risk factors. In association with the surgery, those with surgery will be getting more bed rest, and that may be leading to the immobility will be leading further leading to the formation of the blood clots. Then the history of DVT. Once there is a previous history of DVT, that will also increase the risk of further DVT formation. Then the pregnancy, then trauma, then estrogen therapy, age over 50, and the obesity. These are the main risk factors. In the pathophysiology, when the platelet plug adhered to the endothelium or collagen, adenosine diphosphate is released. The ADP is also released from the damaged tissues and disrupted platelets and form the platelet plug, and the thrombi range from 1 meter to long and found mostly in long veins. And within 24 to 48 hours, the newly formed thrombi may become pulmonary emboli, and that may lead to a drastic complication. As the thrombi enlarges, they may obstruct the veins, and the resulting inflammatory response may destroy the walls of the veins, and thus venous insufficiency and the post-phlebitis syndromes are initiated. As a result of the occlusion, the venous pressure increases and collateral circulation develops, which relieves the increased pressure and volume. Then the clinical manifestation, as you all know, the main clinical manifestations are pain, then the unilateral swelling distal to the site, and redness or warmth of the legs, then dilated veins or low-grade fever, and Homan sign and the insensibility. The Homan signs means once we are pushing the means once the patient is in the straight position, and when we are pushing or the foot backwards, then the patient will be having the calf muscle pain. That is the positive Homan sign. Then coming to the diagnostics, mainly the diagnostic evaluations are the Doppler ultrasonography flowmeter, then venous duplex scanning, and the plethysmography. These are the main diagnostic evaluation. The plethysmographic means we will be applying some cuff, means the means cuff will be attached to the thighs, and we will be assessing the volume and the quantity of the blood circulation throughout the legs, and that will be analyzing the blood flow and the viscosity and the adequacy of the blood flow, and venous return will be assessing, and through that we can identify the risk of forming the DVT. Then the medical management is prevention of the venous thromboembolism, then anticoagulation therapy, especially the heparin 5,000 to 10,000 bolus, and 750 to 100,000 per unit per hour, and the coumarin derivative, that is heparin sodium, then the fibrinolytic agents, that is streptokinase and the urokinase. Then the surgical management is venous thrombectomy and the umbrella procedure. The venous thrombectomy means we will be identifying the thrombi and we will be removing the thrombi from the affected portion. Then the umbrella procedure means we will be inserting a filter to the means especially with the IVC, and we will be filtering the blood clot while the blood is passing means returning to the heart, and through that we can prevent the clot formation in the other circulatory systems. These are the main surgical management. And the nursing management, we have to do the assessment, then bed rest is very, very important. And we have to elevate the legs and continuous warm packs relieve discomfort, and monitoring the anticoagulation therapy and monitor for development of pulmonary embolism. These are the main nursing management. And the complications are pulmonary emboli, chronic venous insufficiency, and the post-thrombotic syndrome. The pulmonary emboli means once there is a clot in the legs that may be discharged into the means pulmonary circulation, and that may be leading to a pulmonary emboli formation. And the chronic venous insufficiency means the blood vessel will be getting insufficient of blood supply, and that is a chronic venous insufficiency. And prevention of DVT means how we have to prevent the DVT formation. That is especially during after the means post surgical, we'll be using the pneumatic compressor devices, and which will be means enhancing the blood flow or backflow of the blood to the system, and that will be enhancing the smooth functioning of the veins and all. That's the things. Thank you.